Does cold therapy work for arthritis? Cold therapy for arthritis, it's one of those remedies that keeps coming up. And guess what? There's some solid evidence that it can help, especially with consistent use. But here's the thing, cold therapy means different things to different people. Are we talking ice packs? Ice baths? Let's break it down. Cold therapy, ice packs versus ice baths. Most of the research out there focuses on ice packs for arthritis, not the trendy ice baths you might see all over social media. That said, there's growing interest in using ice baths for specific cases like hand arthritis or even gout. Some early studies show promise, but it's all still a bit too soon to say whether it's any better than standard icing. Now, we already know ice baths can reduce muscle inflammation from injuries, so it's obviously going to have some temporary benefits. So it's not a huge leap to see why researchers are looking into how it might affect long-term issues like with arthritis too. Living with arthritis can be tough, but finding the right tools to manage the pain and inflammation can make a big difference. Cold therapy is one of those tools that shows real promise. How does cold therapy work? Cold therapy, also called cryotherapy, works by applying cold to the inflamed joint. This can be done with ice packs, cold compresses, or the more intense option, full immersion in ice water. Here's what happens when you cool down an inflamed joint. First, we have blood vessel constriction. Cold reduces blood flow to the area, which helps bring down inflammation and swelling. Then there's the fact cold slows joint fluid production. Excess joint fluid can make swelling worse. Cold therapy can reduce its production, easing discomfort. And of course, it distracts the brain from pain. Cooling stimulates sensory receptors in the skin, which can reduce the transmission of pain signals. This is obviously more of a short-term benefit. Interestingly, full immersion, like plunging your hands into an ice bath, seems to work particularly well for hand arthritis. And it seems that the benefits do seem to increase over time, which is the really interesting bit. How to use cold therapy safely. Now, cold therapy sounds simple, but there are a few key guidelines to make sure you're doing it safely and effectively. First, use a barrier. Never apply ice directly to your skin. Use a towel or cloth to avoid skin damage. Next, keep it short. Limit sessions to 20 minutes. Any longer, and you risk frostbite or ice burns. And of course, listen to your body. If it hurts, stop. Cold therapy should reduce pain, not cause it. Lastly, know your limits. If you have conditions like Raynaud's syndrome or cold allergies, consult a doctor before trying cold therapy. Should you alternate with heat therapy? Here's a pro tip. Some people get the best results by combining cold and heat therapy. While cold reduces inflammation and pain, heat improves blood flow, relaxes stiff joints, and boosts flexibility. If you decide to alternate between the two, just remember to let your skin return to its normal temperature between applications. So, does cold therapy work for arthritis? It definitely has potential, especially for reducing inflammation and pain. While most of the evidence supports using ice packs, there's growing interest in ice baths for specific cases like hand arthritis and gout. As always, make sure to use cold therapy safely, and don't be afraid to experiment with heat therapy to find what works best for you. If in doubt, consult a healthcare professional to tailor your treatment. If you've tried cold therapy or are thinking about it, let us know in the comments. We'd love to hear your experiences. And don't forget to like and subscribe for more tips on managing arthritis and living pain-free.